now commence the Q&A session. Thank you for all sending in your questions. We have collated the questions and I will try to get through them in as many as possible. I will start with a selection of questions that best represent the main points of concern. And the first question, which I'd like to direct to New South Wales Health, is can you explain the 5 kilometre rule? Is it from the address where you live or 5 kilometres from our LGA? For example, I live in Mascot. 5 kilometres from my home can take me to 2 other local government areas, while 5 kilometres cannot get me to the other side of the LGA at Dulles Point.
Yes, so you can hear me okay?
Yep.
Yeah.
So within Bayside, you must obtain your goods and services within 5 kilometres of your home. So if that does mean that it's in a different LGA, that is okay. And you may only exercise within 5 kilometres of your home. So it's not so much the LGA boundaries that are important there, it's the distance.
Thank you, Dr. Sheppeard. The next question I've got is directed to the Mayor, and it's from Sophie in Bexley. How do I know where the Bayside boundaries are?
Thank you, James. With the boundaries, I mean, what we've done, we've had this question from a number of community members. To make the boundaries very clear, we've published a map specifically for this purpose on our website. So I'll just remind our community, if you go on the website bayside.nsw.gov.au, we do have specifically a map for that. So that'll give you the boundaries.
Great, thank you, Mr. Mayor. Question 3 is, I'm a widow and my son lives in a different LGA further than 5 kilometres. Can he visit me and can you define the carer's restrictions? If I can put that over to you, Dr. Sheppeard, please.
Yeah, so the declared area doesn't really make any difference to whether your son can visit. So if you could be his, he could be your nominated single bubble visitor, and another way to interpret that might be that if it's a care and compassion visit. So they're looking at it in either of those ways, then your son is able to visit using one of those mechanisms.
Great, thank you, Dr. Sheppeard. Question 4, if I can direct this to Inspector Halliday. I still see people gathering on ovals, playing soccer and chatting in groups. What do I do and why is this still allowed when we are trying to do the right thing?
Oh, thanks for that. Obviously, a lot of that behaviour is actually not allowed, and there's also a restriction on recreation within the LGA. In those circumstances, if you see people doing the wrong thing, you're very welcome to ring Mascot Police Station or Cogra Police Station. That's your local police stations, or of course Crime Stoppers on 1800 333 000.
Thank you, Inspector Halliday. Question 5, if I can direct this to New South Wales Health. I work out of our LGA. Do I need to get tested every 3 days to go to work?
No, only Canterbury, Bankstown, that doesn't apply to Bayside. It only applies to 3 local government areas, not this one.
Okay, thank you. The next question, if I can direct to the Mayor, it's a question from Damien from Rockdale. What financial relief has Council put in place for residents?
Thank you, Deputy. Look, Council's put in place a number of measures and fee waivers to assist our community. I mean, I'd like to just quickly point out a few, just list a few. Throughout this pandemic, we've got 0% interest rate on overdue rates and annual charges, and that goes until the 31st of December 2021. We've also got waiver of interest on late payments. So if you pay your rates late, for payers who enter into a payment plan prior to the 1st of January 2022. So you've got to apply for the waiver, for the interest waiver. What we've also done, full rental waiver for the period of the public health order or the 31st of December 2021, whichever comes first, for commercial tenants in council-owned properties unable to operate their business due to the current restrictions. Full rental waiver for community tenants of council facilities until the end of the year also, 31st of December 2021. And then waiver and a refund for ground hire fee for all Bayside community sporting clubs, because as we know, sport has not been possible as far as soccer clubs and other clubs. So with seasonal booking until the 30th of October 2021. I'd like to also mention waiver fee and charges for outdoor dining licenses, footpath trading fees, library overdue fees, work zone permit fees, and fees for residential development application with a development value of less than 100,000. So helping those do a renovation. I'd like to quickly mention, in addition to these fee waivers, council's already allocated an additional 100,000 for community grants to eligible applicants to address the operational impact of COVID on service provider organisation. Now, these grants will open for application to the community next week, so keep an eye on that. So we've got 100,000 out there to help the community in grants. So keep an eye. Next week will be available to help people in the community. So have a look at the website and you'll see it there.
Thank you.
Hope that.
The next question I'd like to direct to New South Wales Health. I have seen QR codes in outdoor spaces like playgrounds. Why do I need to check in when I am outside?
Yeah, thank you, Councillor. I'm not aware that that is a thing, and I don't know if the police, if Inspector Halliday is able to comment. I don't believe that outdoor places do have check-in requirements.
I understand that through one of our last meetings that Bayside will be having QR codes on play equipment in the local area.
Thank you. Okay, the next question again to New South Wales Health. What are the main differences between an area of concern and Greater Sydney restrictions?
Yeah, I think I did cover that in the presentation. So it's only authorised workers can leave Bayside to work. It's about the outdoor recreation not being permitted and wearing a mask when you're not at home, even when you're outdoors. So those are the main differences. And otherwise, the restrictions are very similar.
Thank you, Dr. Sheppeard. Again, another question for you, Dr. Sheppeard. I am in the 16 to 39-year-old category. I go online and the eligibility checker says I am not eligible. I can't get a booking. How do I book my Pfizer appointments?
Yeah, so and I probably need some help from my colleague here, Lisa, who's online. Probably the bookings at Novotel did fill up very quickly, but there will be more bookings available. And certainly being a Bayside resident in that age group does mean that you are eligible for Pfizer. So I would suggest keep on checking that site for the next couple of days. And if we've got your email, come back to us and we'll see what's going on there, because you certainly are eligible to book at the Novotel.
Thank you, Dr. Sheppeard. Now I have a question again for the New South Wales Health or the police. It's a question from Fiona in Dolls Point. I'm a runner. Do I have to wear a mask when I run?
Well, thanks. I understand there is an exemption to mask wearing for strenuous exercise.
Yes.
where the exercise affects obviously your ability to breathe through the mask.
Yeah, it's preferred that you do wear it, but if it interferes with your exercise, then you're able to remove it.
Right, thank you. I think that was a question that's been asked many a time. Thank you for clearing that up. The next question again for New South Wales Health. Can you explain compassionate reasons for leaving the LGA?
Yeah, so I think perhaps the earlier question that talked about perhaps an elderly parent that's elsewhere and you need to go to help them around the house. It could be if another part of the family, there was some essential childcare that had to be done. So it's about those important family reasons, but if that happens, it can only be one person that goes to that other house to carry out the compassionate reason, or if there was a family member critically ill in hospital, then that kind of exemption could apply. So that's what compassionate reasons for leaving the LGA would include.
Thank you, Dr. Sheppeard. Another question. I want my children vaccinated. When will under 18s be vaccinated?
Yeah, so the Pfizer vaccine is already registered for children from 12 years of age, and the Moderna vaccine has an application in for that, so we expect that will be through later in the year. What New South Wales Health is hoping to be able to offer later in the year is school-based vaccination for children 12 years and older. So we don't have any details about that yet, but working through those plans at the moment.
Great, thank you. Another question on vaccination. Why aren't our new vaccination centres appearing when I search online?
Yes, so I think you're perhaps looking at the online searcher is from the Commonwealth, and again, so these are local initiatives for local districts, and perhaps someone from the council can help me about how local residents are able to find out about these initiatives.
We'll probably include that on the questions that go out with a number of the other ones that need to be answered as well. We'll clarify that. Another question to you, Dr. Sheppeard, please, is a lot of people I know are getting very anxious and depressed. What is there to help people during this time?
Yeah, well, I think Rani covered a lot of the initiatives that council's implementing, and so I guess we could talk for a long time about how to cope with this situation. I think it's a very shared situation. It's now right across New South Wales, and I think each person needs to find their own way to be able to cope. It's about finding what helps you, and finding other ways to connect with people online through things like Zoom, through telephone calls, and many people can using those coping mechanisms, the exercise, having meaningful pursuits at home. These things can help many people, but of course some people can't manage and do need additional help. So that's, in those cases, reaching out to your GP, reaching out to the other social services that are available, because everyone is, if they need help, they should be calling out for that, and that it's certainly a lot of programs available to help people during these really tough times.
Thank you again, Dr. Sheppeard. Another question. I think you've got most of the questions. How do we get out of being an area of concern, and what is the path for that?
Yeah, that's a really interesting question. I think, as the Mayor pointed out, this is very new times, and the rules are changing very frequently. And so at the moment, this declared areas was something that began just a couple of weeks ago. We don't yet have a set criteria for Bayside to no longer be a declared area, but certainly the kinds of things that I'd be watching for to recommend up to the Chief Health Officer is, fewer cases each day, fewer unlinked cases so that we always know the source of the case, and improved vaccination rates. So and maintaining the testing rates as high like we saw in the last week. So if we can get all those things happening and the case numbers are coming down rather than staying steady, then I believe I can recommend to the Chief Health Officer that Bayside wouldn't need to be a declared area any further, and she could then discuss that with the Minister.
Great, thank you, Dr. Sheppeard. The next question I'd like to direct to the Mayor. It's a question from Sharon in Hillsdale. Shared paths are problematic, with many people sharing our paths, particularly along our foreshore. What can we do?
Thank you, Deputy. Look, as it was mentioned by the doctor and inspector, outdoor exercise is permitted with one other person. A mask must be worn, and I think we've gone through that about running and so forth, unless doing a very strenuous exercise like running, which was mentioned before. Look, we would ask people to maintain social distance on our shared paths. You've got cycleway, you've got people with prams, people running, walking. So many of our busier paths are delineated because we've got it quite separated to assist in the flow of pedestrian. Bikes, like I mentioned, with the prams. Council, New South Wales Health and Police have daily briefings where any compliance issues are raised, and we discuss strategies on how best to address them. We're hoping that the 5-kilometre restrictions, which we didn't have in 2020, will mean that there'll be less people from outside the LGA using our foreshore. It is also advisable to time your exercise in not a busy period, I guess. That would be a good strategy.
Thank you, Mayor Awada. The next question I have for Inspector Halliday. Bayside LGA is large. Why can't we lock down by suburb?
It's an interesting question. I think borders are a bigger issue we can't handle locally, obviously with health considerations. We've also got to look at issues such as the spread of COVID-19 in neighbouring communities from the southwest across the east. Management of all the government response. So at the moment we have a combined EOC running, which so there's no duplication of services. And if you look generally, I think if we lock down by suburb, we start to see greater restrictions on the residents and also a strong growth in anxiety and stress.
Thank you, Inspector Halliday. Now, I have another question for you as well, which is a very popular question. Can I give my son or daughter who lives with me driving lessons around our LGA?
Yeah, as you know, driving instructors aren't authorised workers in the LGA as a declared area. However, residents of the same household, so mum and dad, are authorised to give their children driving lessons, but it should be within 5 kilometres of the house.
Right, thank you for that. The next question I have is for New South Wales Health. What is the difference between exercise and recreation under the public health order?
Thanks. Yeah, and I think Inspector covered this before. So exercise means that you would be walking, running, doing swimming, whereas, or you could be supervising children at a playground, whereas recreation might be sitting on the beach, on a bench, etc. So you can do the exercise, but not the passive being outdoors away from your home, unless you're supervising children at a playground or supervising children exercising.
Thank you, Dr. Sheppeard. And here's another question which is quite interesting. Is it true that you can sunbake at the beach if you are not in an LGA of concern?
Yeah, so that would be recreation. So at the moment, Bayside residents can't do that, but in other LGAs that are not declared areas, and again, I defer to the police, but I believe that would be acceptable as long as the social distancing was maintained.
Yeah, that's correct. And they've got to, even those people in undeclared LGAs have to abide by the 5 kilometre distance rule.
Thank you. The next question about construction, I have the New South Wales Health. Can you please explain what the new orders mean for Bayside residents working in construction?
Yeah, so yeah, this is an important difference. So if you're working in construction and you're living in Bayside or one of the other declared areas, you need to have had 2 doses of vaccine or had 1 dose at least 21 days ago. Or if you've had 1 dose and it's not like only last week, then you still need to get that the testing the COVID testing every 3 days. So and there's also a medical contraindication option there. So and then you've got to have the proof of having one of those 3 criteria, and it's also incumbent on your employer to have checked that you've complied with either the vaccination or the testing requirement.
Great, thank you, Dr. Sheppeard. So this almost brings us to the end of the Q&A, and I'm mindful of the time. So the last question I do have is for the Mayor. Will scheduled garbage collections and council clean-up days continue? This question is from Maria in Botany.
Sure. Thank you, Deputy. Look, I'm quite happy to say the answer is yes, there will. The only service temporarily closed is the community recycling drop-off events at Botany and Bexley Depot. These are temporarily closed to encourage people to follow the stay-at-home order. In summary, all our services that can pick up from your in front of your house or your curb continues as per normal. Your red bin, the yellow bin, all the services. Yes, it will continue.
Thank you, Mayor Awada. I'd also like to thank Inspector Shane Halliday and Dr. Vicky Sheppeard for their time. I'd also like to thank Meredith and Rani for your time as well. That's about wrapping up with the question and answers sessions, and I hope that has been clarified. It's clarified some of the confusion about what we can do and what we can't. A reminder that if you've asked a question in our chat room that we haven't answered, we will be responding to you as quickly as possible. A list of the full Q&As will be on Council's website in the coming days. This session has been recorded and will be available on Council's website and Facebook page. So be assured that to share it with your friends in the community who couldn't join us tonight. It will also be available on request in other languages for our multicultural community members. Details about how to access this will be in the chat room. I would now like to invite Mayor Awada to say a few closing words. Thank you to everyone.
Thank you, James. I'd like to join the Deputy Mayor in thanking our speakers tonight. The message, I think, from everyone is loud and clear. Let's do the right thing, and wherever possible, stay at home. If unwell, get tested, and please get vaccinated. Council customer call centre is available if you need further advice or assistance. Please don't hesitate to call the customer service call them between 8:30 a.m. and 4:30 p.m. Monday to Friday. There's also the after hours service on the weekend. Details are on Bayside Council's website. Again, thank you to everyone for joining us online tonight. We hope it's been helpful, and we urge you to stay at home and stay safe. Good night, everybody.